Okay, so now we're going to be going over is essential nursing abdominal assessment. And again, this is sort of just one piece of a larger head to toe assessment, just sort of focused in. So we'd want to start by greeting our patient, doing sort of our quick general survey, introducing ourselves, explaining to them what we're doing. We typically would start an assessment with vital signs, so we would do that. And there's, again, no shortage of subjective questions you can ask somebody, but about their history, etc. But lots of that information typically would be found in the chart if this wasn't sort of the initial admission assessment. So we're going to assume that this patient's been here for a little while, and we're just going to ask him some of those questions that you would actually ask on a day-to-day basis. Are you having any abdominal pain? No. Are you having normal bowel movements?
Yes.
When was your last bowel movement? Those kinds of questions. If they're having any dark or tarry or irregular stools, could also ask them about their urination habits. Is it normal? Is there any dysuria, hematuria? Are they urinating often enough? And you could ask them too about their appetite. Are they eating okay? Any nausea, vomiting, those kinds of things that you can ask on a day-to-day basis. We're going to start with inspection of the abdomen. You want to keep the person, again, as little position changes as possible. Also, you want to keep them comfortable and maintain privacy as much as you can. So in this case, if our patient was laying down at first, I would start by just assessing his abdomen laying down. And we don't have a blanket here because he is wearing shorts, but I would probably cover up to his hips with a blanket at this point. And Justin, is it okay? I'm just going to lift your gown up so we can look at your abdomen here. So always we're going to start with inspection. So we're looking at the contour of the abdomen. You could have a protuberant abdomen, a scaphoid abdomen sort of sunken in. You just kind of want to look at the contour of the abdomen. His looks fairly normal, flat, no obvious masses or anything sticking out. And he denied any sort of pain. And typically when you're doing an assessment, you go from inspection to light palpation, then auscultation. But with the abdomen, it's a little bit different. You don't want to actually jump into palpation just yet because you can disturb the bowel sounds. So we're actually going to auscultate before palpating with the abdomen. And when you auscultate for bowel sounds, typically it's with the diaphragm, and you're going to start usually in the right lower quadrant because bowel sounds are often caught here right away. So you're going to listen for long enough in each quadrant so that you can capture the bowel sounds. They're normally like a high-pitched gurgling or cascading sound is how they're described. They happen, depends on the person or the situation, but they do happen quite often. So you're usually able to capture them. And you want to note if they're hyperactive, hypoactive, or absent. And you're just moving in a systematic fashion to all four quadrants. Good. To determine that bowel sounds are absent, you actually need to listen for a full 5 minutes without hearing any sounds to determine that they're absent. So it actually takes quite a while to determine absent bowel sounds, but it can happen. So now we're going to move into light palpation. Light palpation is part of the essential nursing assessment. Deeper palpation is done as more of an advanced practice skill where a trained practitioner is feeling out for specific masses or organ size. So we'll just do light palpation, and typically what you do there is use 4 fingers and you go about 1 centimeter depth. I'm going to be talking to him while I'm doing it, looking at his facial expression if he has any grimacing or guarding. So any painful areas I can kind of get a sense of. And we're just going to move again in sort of that clockwise fashion through the abdomen. At this point too, while palpating, and again, not deeply, and he's not any pain?
No.
No. So I'm also getting a sense for, we had inspected the abdomen and its shape, but now we're getting a sense of, is it a firmly distended abdomen? Is it soft? You can kind of get a sense of the feeling of it too. And combining a couple of our assessments, this would, when we were listening to bowel sounds, not a bad time to also listen to the aorta, the abdominal aorta for bruits. And of course, if you heard a bruit, you wouldn't want to go in there palpating necessarily. On some thinner people, you can see the pulsation of the aorta as well. So you can note those things as well when you're in sort of this general vicinity of the abdomen, but he has no pain. Abdomen is soft, no obvious masses or lumps noted. Sometimes you can feel a distended bladder. It's a little bit firm, just above the pubis symphysis or pubic bone. And the person may feel that discomfort too if they do have a full bladder. It can be a little bit tender if you do palpate that. So yeah, no major concerns there with your abdomen. The next thing we're going to do for an abdominal assessment, kind of just fits in with the kidneys, is we're going to do CVA tenderness or costovertebral angle tenderness. So I'll just get you to sit up, Justin, with your legs over the side, just like that. So we're going to go to the costovertebral angle, and you're going to put your hand flat there, and you're just going to do a light thud with your hand and ask the person, they should feel the thud or the pressure sort of, but it shouldn't be particularly painful. And so if it is painful, and you would do it on both sides, is that painful?
No.
Okay. So you are getting a sense, if it is painful, that could mean that they have some kidney inflammation, and you'd want to maybe do further testing there to rule out any issues. So those are the basics of an abdominal assessment.